Why should people come and listen to my presentation? Hopefully, it will give them an opportunity to learn about how and why we failed to adequately respond to AIDS in the early years of the pandemic, and will give them an opportunity to better understand what is needed now to respond effectively to the AIDS pandemic and to other pandemics in the future. I primarily wanted to write this book to tell the story of the World Health Organization's global program on AIDS, which was the first program to lead the global response to the pandemic. I was privileged to direct this program for 5 years and to work with 500 staff who passionately were devoted to coping with the pandemic and helping countries deal with it in its initial stages. This program lasted 8 years. It was closed down at the peak of the pandemic and replaced by UNAIDS. Many persons today who work in the field of AIDS do not know the history of the program and all the challenges and obstacles it faced and its achievements. The book's biggest takeaway is that the global response to any pandemic is a complex process. It requires a multifaceted approach, an understanding of global health governance, true partnership among the global actors, and accountability by all those involved in leading and financing the response. Many people feel that AIDS created the field of global health. It was the first modern global pandemic. It required a multi-sectoral response. It demonstrated the importance of community-based organizations and advocacy in global health. It has helped to establish the field of health and human rights, and it greatly increased financial resources into the field of global health. By understanding how and why the world responded to AIDS, we hopefully can get lessons on how we can continue to respond appropriately to AIDS, but also to other pandemics which are sure to come. We now know that health is essential to economic and social development, and in turn that economic and social development help to bring about a healthier society. The two are clearly intertwined, and this was very evident, for example, when people with AIDS lost their jobs and were ostracized in their communities. We've also seen that new and emerging diseases, at least one every year, pose a great threat to human security and can move rapidly around the world. Many persons are asking the question about how to generate political will today for the global response. Unfortunately, we've become victims of our own false, misguided optimism and become complacent now that we have effective HIV treatment, despite the fact that we still need to place over 17 million HIV-infected persons on treatment. We need to remind persons, particularly youth, in as many ways as we can, how AIDS in the past devastated many communities around the world and still is a threat to our health and security. I can think of three main threats to a successful response from here on in to AIDS and HIV. The first threat is complacency, which now we unfortunately have because of effective treatment. Heads of governments, particularly in Africa, rarely talk about AIDS. They're once again almost denying the problem. In the past, we had great activism by civil society, and it played such a key role in advocating support for AIDS. That too has waned. A second threat is the idea that we can simply integrate AIDS programs into general health systems or universal health care. That would be a mistake. We need to strengthen health systems, but we also maintain a strong focus on HIV prevention and treatment. And a third challenge, of course, is financial. We continue to need financial resources to support AIDS programs in affected countries. Right now, the United States is the only country left with a significant bilateral program for AIDS, and that funding is under constant threat. The world itself is under threat from the rise of populism. We as a global community need to stay together and maintain a focus on our shared needs and values. Universal health care has gained great momentum today around the world, being strongly promoted by WHO and other agencies. No doubt the continued separation of HIV services, prevention or treatment from the provision of other healthcare services is not sustainable. AIDS healthcare programs, prevention programs need to be integrated into national health systems, but really this must be done carefully so that the critical components of these programs are not lost and the differing needs of countries when it comes to AIDS are adequately met. AIDS needs to be approached in both a horizontal way and a vertical way. Some people call this a diagonal approach to AIDS care and treatment. Yes, AIDS is a normal infectious disease in that it can be treated, though not cured, successfully. But is also an exceptional disease still today in that it is transmitted through behaviors that are taboo in many societies, so that those who are infected or associated with high-risk groups can still face great stigma and discrimination, which prevents them from receiving the care and support that they need, which someone with a, quote, normal disease could receive. We need to make better use of technologies and communication platforms that are available today. Particularly in reaching out to youth, we can use the social media platforms to provide messages to them on prevention of HIV. We can also use these platforms for our advocacy efforts to confront the continued stigma against AIDS and the denial and belief that the pandemic has come to an end. The epidemiological information that we need to be able to reach high-risk groups is now much more available through our technology platforms. We need to make use of those as well.